You know, I had so many different experiences here in China. China is a great country. The comparison I can do, even considering that I've been in so many different places. Yesterday was a very nice, very well organized. The first feeling I got, then in this 4 years, nothing really stopped. In my feeling was everything stopped. What impressed me, the average of the age of the people attending. So in the past years, we educated people, they were really in need to have that, because the average of the age of the people attending was about 40 or something like that. And now, probably in this time, we already educated this. Now they are younger. That's a very important, as a great advantage, I think, because we can set up a different way of teaching. We can do new program. People can follow new program. We have the opportunity to create a long-term program and conduct this. For sure, that's a great advantage, especially compared to the other country. I've been recently in many meetings in Europe and USA. Here, the critical mass of young people is much more, and so we can build something new, absolutely. And especially, we have to take the responsibility to create a long-term program for us, but people like me hope to retire soon. And even for other people we can. We have to give instruction how to lead a training program. We have the average of the age is younger, and that's a good sign. The critical mass of people, because the quantity of people is impressive. My average of presence in my course like this, is 30, 40 people, 40 rare. It's normal in Europe, it's normal in US, it's normal in South America. But here was normal 150 people like yesterday, more or less. So we have to consider even that. Then we can, the importance is the quality of the teaching. That doesn't mean immediately high level, but mean pay attention what the level of the starting level you have, the people, who, the basic education they have. Then set up a program step by step, long-term program. At the end, the quality of teaching, the quality of instruction, structured in training on how to do an exam and how to interpret it, an exam. Those are steps that we have to respect and build a program that at least, I would say, should be at least 2-3 years. The program could be the ideal, get by yourself, because your certification comes from the quality, the knowledge you really have, you really offer, and people will follow you and follow who gave this kind of training. The important is to create a serious program, to the step, the background they have, and build what they need. I'm talking about program 2-3 years program. It looks long term, but if you watch back, with past 4 years, it looks yesterday. So a 3 years program is the minimum. 2-3 years program is the minimum to create a certification, a good quality certification. So this clinical individual prevention means we have enough instrument, technical instrument, like this one, like the ultrasound, like electrocardiography, and so what else, we are able to make diagnosis before symptoms. That's the important point. And so we have to structure the prevention like in human. If they respect, they have a certain age, some checkup. And a checkup is something recommended, and if you identify the anatomical modification of the disease incoming, that is the time you can start even giving treatment even before symptoms. It's time to treat patient, give the right treatment even before symptoms. That will improve the life expectancy. But that's one of the parts of the prevention. Another part of the prevention I find is very important is the prevention on the breed screening. You see now animals, they are fashion for certain animals, for certain breed of dogs, for example. And people are going to bathe these animals. We did a study, retrospective, in the last 20 years in Europe, and we published it a couple of years ago, that we identified that when a breed is more on fashion, there is much more request, and there is much more inbreeding of these animals, create a largest population in a short period of time. So the incidence, for example, of inherited disease, in my case cardiac disease, increased dramatically. That's another point of prevention. We trained, and now in Italy, which is compared to China, is a small country, so the population is like 2 cities in China. Yeah, you know, we have done training for vets. We trained 100 vets to do in the same way, exactly the same way, echocardiography, to do the breed screening for the animal is going to be used to breed. And so to prevent disease, to identify congenital disease, inherited disease. And so, doing this, even the rest of Europe, other countries started to do this. And so they are following our instructions. So there are 2 lines of prevention: individual prevention and breed screening. For both of them, ultrasound, cardiac ultrasound is the main tool. But important is what you study, how much you study, and how much willpower you put in improving your profession. It's the advice I gave to young and older professionals. They have to be updated, to keep updated, to keep the right interaction. I think I've seen in any part of the world, I've seen that the level of knowledge and the professional level of the specialist is strongly related by the interaction they can have with their special society. The specialist society, the cardiology specialist society, in any country they have one. And depending of the willpower of the teachers, they want to share their knowledge, and that how much they are able to involve people to have unupdated information, that will create the level of the knowledge of the specialist. The key point is interaction and leading. Somebody that does, they are leader, and the leader, they don't want to be just a sort of great leader to be admired at all. I'm not meaning that. Leader to able to share his knowledge and dedicate his time to improve the level of the people around him. Because if they improve, you improve. So they have 2 types of leaders. So the leader who is scared by the junior to lose his leadership. And that's stupid, it's just a boss, it's not a leader. But the real leader is a leader who wants to improve the knowledge of the youngest, because he realized, that's an intelligent leader, that if they grow up, yes, you're still growing up. I mentioned it before, I haven't mentioned the good ultrasound machine, but I've mentioned a good knowledge about how to interpret ultrasound exam and how to perform ultrasound exam. That is probably the easiest part. The more difficult part is to interpret, to get all the information, put together the information. But that's the point regarding the human side. Regarding the machine side, I think now, at least for the general practice, it's important the image quality. Work with a low image quality, it's possible to do, but need to have a great knowledge of personal use. If you want to give really value of the ultrasound exam in general, you need to have a very good image quality and all the basic performance of a machine. I mean, good color Doppler, good spectral Doppler, good 2D image. And that is not easy, because you know, not all machines have this, and not machine available on the market. have this. I think that is the point to be focused. Even the basic, the entry-level machine need to have that. Need to have that. Then after, of course, are getting on the market many function, many software that you can apply. I think the important point, the first important point is to make a software and function that are really a tool, a real tool, real something that you really need and really helpful for you, and a tool but not a gadget, a tool. That's the difference. And the important is, for example, the possibility to exchange imaging. So the opportunity to have available a PACT service and a way to send rapidly the image in an easy way to other experts to have a consultation. That's a software that is important to offer and will help to grow up everybody. That's a key point, I think, one of the key points. Then after, of course, new technology, we are still calling new technology born 15, 20 years ago. So strain, 3D or what else. But those are changing step by step. Those are improving step by step. You know, those are something that we can use. Some advanced level center is going to use, and of course it's important to offer a good quality of this software. I think for the veterinary field, since my experience, I've done so many years working even in the human side as a pediatric cardiologist. And you know, for any of these technology, we need to know exactly where is the application field. So even for that, education is important. To tell people, so strain is useful for this disease in dogs, not for all of them, and not the same disease in humans, but in animals, dogs and cats, you may use and they give you information. 3D is the same. We are going to start even veterinary medicine. There are a few centers that are doing that. The risk is to give something in a place where they just want the gadget, but they don't know to use. So then on the other side, the quality is not controlled enough that is really good. We need to be aware. So consciousness of what we are doing is important at any step. But anyway, this is something for the second tier level center. For the first level center, the important is the interchange of the information, how to share image quickly.